Good day everyone, I am Jessa Megokin from BSN1A and today I will demonstrate to you on how to check the vital signs. Vital signs has three components, the temperature, pulse, respiration, and blood pressure that indicates the state of health of an individual. It is also represent interrelated physiological system of the body. The purposes are to obtain the first temperature of newborn and to check the rectal patency, to check the core temperature of an adult, to obtain an estimate of the quality of the heart's action per minute, and to obtain the respiratory rate per minute, and to estimate of the patient's respiratory status to aid diagnosis and to observe changes in a patient's condition. Temperature is the difference between heat produced and heat lost by the body. Pulse is a rhythmical throbbing that results from wave of blood passing through an artery as the heart contracts. Respiration is the exchange of oxygen and carbon dioxide between the atmosphere of the body cells, and it is initiated by the act of breathing. The equipment needed in this procedure are the following: thermometer, sphygmomanometer, stethoscope, jar of cotton balls in alcohol, jar of cotton balls in water, jar of cut tissue papers, jot down notebook and pen, watch with second hand, and alcohol swab. So first, wash your hands for infection control and assemble all the equipment and check for the completeness of supply, and then bring the materials to the bedside to promote efficient time management. And then introduce yourself and identify the correct patients to provide appropriate nursing intervention to the right patient, and explain the procedure to be done to promote cooperation. Good day, ma'am. Ako gali ang imo nga nurse subong. Pwede ko pala ng iyong pangalan? Okay, Ma'am Jaira, kuhaan pa kasubong sa vital signs. Ang vital signs ng may ara sang temperature, pulse, respiration, kag blood pressure. Kuhaan ta kasi hindi ni siya masakit, kag cooperate lang ta. In assessing the temperature, position the patient and expose the axilla to make the patient feel comfortable and to facilitate of assessing temperature to the axilla. Ma'am, lang ayuson ta lang mga butang natin. After this, pat the axilla dry if it is moist. It can cause inaccurate result. Ma'am, trapuhan ko, ma'am, ha. Wipe the thermometer in a firm rotating motion using the cotton with alcohol. Wipe it from bulb to stem to prevent spreading of microorganisms. And then, press the on button to turn on the thermometer. Place the thermometer well into the mid-axilla with the bulb directed towards the patient's head. Bring the client's hand down close to his body and place his forearm over his chest to allow the accurate temperature. Ma'am, ibutang ko sa imo, ma'am, ha. Leave the thermometer in place until you hear the alarm sound of the digital thermometer for allowing enough time for the thermometer to alarm permits accurate measurement of patient's body temperature. And then, wait the thermometer to sound. Paan ko na, ma'am, ha. And then, read the thermometer to record and interpret patient's body temperature. After that, press the off button of the thermometer to turn it off and clean the thermometer in a rotating motion from the stem to the bulb using an alcohol swab or cotton ball with alcohol to prevent the spread of microorganisms. And then dry and place the thermometer in its container for proper storage. After that, dispose the cotton balls in the receptacle used for contaminated items for controlling the spread of pathogens. In assessing the peripheral pulse, in utilizing the opposite extremity, locate the peripheral pulse site to perform the procedure simultaneously. And then, assess the patient in placing the hand on top of the chest with palm facing downward to facilitate the measurement of the pulse and respiration without patient knowing. Place 2 or 3 fingertips lightly and square over pulse point. Using watch with a second hand, count the number of pulsations felt on the client's artery for 1 full minute in order to gather a more accurate data. Assess the pulse rhythm and volume. In assessing the respiration, after measuring the pulse, leave your hand on the patient's wrist. This is allowed the nurse to measure respiration without patient knowing. And then observe and count the patient's rise and fall of the abdomen or chest for 1 full minute to gather accurate respiration. And then observe the deep rhythm and characteristic. And rhythm, normally respiration are evenly spaced, while characteristic, normally respiration are silent and effortless.